What does 1, 2 and 3 areas of Botox treatment mean? I'm Dr. Kate Bennett-Brown of Dr. Kate BB Aesthetics. I'm going to explain to you guys what these areas are and why we treat them. We can treat just 1 or 2 or all 3 of these areas. The first is our forehead muscle, also known as our frontalis muscle. It raises the eyebrows and it also causes these lines when doing so. We can target this treatment area by placing a little bit of Botox along this area here. The second area is called our frown line. This is a collection of muscles that sit in the middle of the eyebrows here. They act to pull the eyebrows down and in like this, creating that frown line. Typically, we would inject around this area to soften these lines and stop the frown lines being created. The third area is commonly known as crow's feet. This is in the outer part of the eye here, and these lines are created when we smile, like this. This is actually a circular muscle that goes all the way around the eye, called the orbicularis oculi muscle. Typically, your injector will put some Botox in around this area to soften those lines. Sometimes you might also have the under eye area treated here, or if you're looking for a really subtle brow lift, they may just put a little bit of Botox in up here to help prevent those eyebrows being pulled down as much. When we start treating the forehead and the frown line, we have to look carefully at the patient we're treating and think about the position of their brows and how this treatment is going to affect them. For example, if I was to put Botox in just my forehead and I didn't treat my frown line, I would lose the pull of my forehead lifting my brows, but I would still have the frown line pulling them down. What can then happen is you could end up with a brow drop in some people where your brows sit heavy, and it's not something people typically want. Similarly, sometimes people will come to us looking for a brow lift. This is where we use Botox to target the muscles in the forehead and frown line and also the orbicularis oculi muscle. And by treating them in a certain way, we can actually create a subtle lift in the brows, raising them up a little bit. If you're not sure if you want 1, 2 or all 3 areas treated, get a consultation with your practitioner, talk about the results that you're looking for, and they'll do a full facial assessment and be able to advise on what might be suitable for you. Okay, I hope that was helpful. If you have any questions about that, drop me a message in the comments and I'll get back to you.